Thank you, viewers, for watching 80 television. I'm Dr. Mpumuzibe Kenneth. As usual, we usually bring you special topics that help us to know about our health, and it usually helps us to live in good conditions. I'm Dr. Mpumuzibe Kenneth from Mars Medical Specialist, which is a specialized medical center located at Kianja Farmhouse opposite the Lakeview Hotel. And as usual, last time we talked about other topics like pneumonia, but today I'm bringing a new topic that is very helpful and it is becoming a problem in our community. That topic is more related to women other than men, but as we live together, you know, a man cannot survive without a woman, and so we need to know, even though men you don't go away, this topic can also gain a lot for men. And this topic is, we are going to talk about miscarriage, or in medical term what we call abortion. Abortion is very common nowadays, very common. Actually, other countries have regularized it, like US, but in Uganda, it is illegal to do abortion, except on a few cases or instances where we'll also discuss on which condition can we allow abortion to be done. But otherwise, it is an illegal thing to do abortion in our country and our loving country nation, Uganda. I don't know what happens in the other policies, but abortion is illegal. So what do we mean by abortion, viewers? Abortion, as you all know, it happens when you have pregnancy, and it happens in females only. So men do not have abort because they don't get pregnant. So abortion is termination of gestational age before the end of 28 weeks. WHO defines it as termination of pregnancy before 500 grams. And therefore, if there is termination of pregnancy or gestation before the end of 28 weeks of pregnancy, that is abortion. And abortion is very common in very many females or women of reproductive age. And it has taken a very big root in youth. And here, since at 80 television, we are encouraging topics that gain youth a lot. We are trying to see how we can improve the health conditions of our youth, because very many people have died from undertaking abortion. We shall see types of abortion and which ones are very dangerous, and the ones which have caused a lot of havoc and death, especially to the youth. And youth, please be with us. Keep with us and learn about the bad things and the side effects and the outcomes, and why abortion is avoidable, and why people talk about abortion, why the Christianity and our and other regions don't allow abortion. So you will learn a lot from it. So after knowing about the definition, now we can see in this generation how many types of abortion do we have. We have very many types of abortion, and these types of abortion, they are different types depending on which stage and how they differ. We shall talk about it. The first type of abortion is called the threatened abortion, and also we have other types like incomplete abortion. We have complete abortion. We have habitual abortion. We have what we call missed abortion, and then habitual abortion is also called a recurrent abortion. And we are going to look at each type of abortion and how it is defined, and how do you know that you have this type of abortion, or how do I know that I might get abortion, or I'm having a threatened abortion. So we have seen that abortion occurs before 28 weeks of pregnancy elapse. So if you have, for example, you have started with we are going to start with what we call threatened abortion. Threatened abortion, it is a type of abortion which occurs where somebody sees signs of pervaginal bleeding, somebody gets bleeding, it might not be painful, but to some extent, some small percentage of people get pain. Low abdominal pain, especially. You are pregnant, before 28 weeks of pregnancy, you see some bleeding, PV bleeding. You know, females know when you are pregnant, you are not supposed to see bleeding. If you see bleeding, there is a problem. And that's why, as medical specialists, we come in to teach you that bleeding in pregnancy, in early pregnancy, is bad. And actually, if it is, we can even have bleeding without pain in this threatened abortion. And therefore, in the threatened abortion, you need to be very careful. See blood and you are pregnant, and you really are concerned about your pregnancy, please go to the nearest medical center or a hospital and seek for medical advice. So that we can know whether you have threatened abortion or you have which type of abortion, the ones I'm going to discuss. So in threatened abortion, don't say that I don't have pain, maybe this is just bleeding in pregnancy. No, it can be threatening. And when it is threatening, the good thing, after diagnosis and they tell you it is threatening, you know that it can be reversed. Threatening abortion, it means your baby or your fetus inside the uterus, it is still alive, but it can come out anytime. And the causes we shall see. Different causes of abortion we shall see. They cause all types of abortion. So if you see any bleeding, plus with or without abdominal pain, and you are pregnant, think about threatened abortion. Go to the hospital. They make an ultrasound scan so that they can diagnose whether it is threatened or any other type of abortion before 28 weeks of gestation. And at Mars Medical Specialist in Mbarara, we do it very well. You come to us, we can check you and know that this type of abortion is threatened. And then we give you treatment, you keep with your pregnancy. And that is so good for us to have more babies being born. Which other types of abortion did I talk about? I talked about incomplete abortion. Let me first talk about complete abortion. Complete abortion is where you lose products of conception, all of them, and the uterus becomes free. It becomes empty. Everything comes out. The fetus and the placenta and all other products of conception, they come out, and the cervix closes. So unlike in threatened abortion where the fetus stays inside, it is alive, and the cervix is closed, in complete abortion, everything comes out, even the cervix closes, and there is nothing that remains in the abdomen, and there is no pain. When the products come out, there is no pain that comes out. Somebody tells you, you see things come out, and you know you were pregnant, you find things on your bed, you find things somewhere, or you see them come out during the day, and everything, when it comes out, you don't feel any pain, and you go to the nearest hospital, they do an ultrasound scan, and they find that you no longer have carrying any pregnancy, and everything has come out. That is complete. Incomplete is associated with bleeding, and then severe pain, that is cramps, and then those cramps are constant and they don't go. So that is incomplete. You know that there is still products, because the uterus, when there is still products, it will keep pushing so that the products come out. So when the all products don't come out, it will keep pushing, and if you don't go to the hospital, my friend, my sister, any youth there, even when you are not a youth, if you hide from people who are concerned, my friend, you can bleed and you become anemic, you can even go to shock and you die before you go to the hospital. So when you have incomplete abortion and feel like feeling a lot of pain, my friend, go to the nearest hospital. If you are in Mbarara, come to Mars Medical Specialist opposite Review at Kianja farmhouse, and we shall give you a lot of help and medication so that you can keep your pregnancy. If you have lost it or it's incomplete, we can still help you to do a manual vacuum aspiration, and we remove those products and you don't bleed today. That is another type of abortion. So we also have another type of abortion which I want to explain, and it is disturbing a lot of people. It's called habitual or recurrent abortion. Somebody gets abortions more than 3, equal or more than 3 times. You carry your pregnancy, before you know it, it is out. Before you know it, it is out. And we shall see a lot of causes of that one, especially that one, because that is where it's called miscourages in our local language. Miscourages. Somebody gets pregnancies, and even you find somebody has like 7 pregnancies they have come out. That is habitual pregnancy, and it happens a lot in people with some conditions. Risk factors can be infection. Risk factors can be hormonal imbalances. It can be endocrinological factors can also cause that. Like reduced prolactin levels, which is a hormone that keeps the young pregnancies until the placenta takes over the role, and then it can be because of anatomical abnormalities. It can also cause habitual pregnancies, and it's common. It's called a miscourages in our local language, and it's very common, and it's not because of charming. Some people relate it to charms and traditional things that are failing the woman to conceive or to maintain their pregnancy, but it is habitual abortion, and we can control it. We can easily do some maneuvers like a miscourage if it reaches before it reaches 12 weeks, and we can put a miscourage and it keeps it there. Or if you have an abnormality like septated uterus, we can refer you to specialists. Even here we have a specialist who can also work on the uterus, and they remove that septum, and then you can the fetus can have enough space to grow from, and you don't have abortion. There is another type of abortion which is very common, and we need to know it, especially in these mothers who take pregnancies when they are very old, about 40 years. It's called missed abortion. A baby or a fetus dies from inside into the uterus, and you don't know. A child or a baby you hear a mother complain that the baby no longer beats. The fetal movements, no longer feels the fetal movements. If you no longer feel the fetal movement for maybe more than 24 hours, you need to come to Mars Medical Specialist in Mbarara here. We can easily do a very nice obstetric ultrasound scan and tell you whether your fetus is still alive and kicking. And therefore, if you don't feel fetal heart beats within 24 hours, more than 24 hours, please be cautious. Think about doing an ultrasound scan from wherever you are, from a nearby hospital, and that's why 80 television is here for, to bring you health tips that can help you, that can give you a guide, that can help you wherever you are, so that you can gain from these topics. So after discussing the topics, but I don't want to leave a good category of abortion that is common and killing our people. Our youth, our generation is dying because of this type of abortion. It is not under that categorization I was talking about, but it's called septic abortion. How does it come? Septic abortion is when you get an abortion and you don't have post-abortal care. When you don't have post-abortal care, that is the medication you get after abortion, you get sepsis or infection that it comes from your private parts, and then it goes into the uterus. So you can easily get pus into your uterine cavity, and that pus can develop, and you get the pyometra. In our language, you call it pyometra, and then the uterus can become flooded, and it can go into the vessels and join the system. You get septicemia and you get septic abortion. If you are not treated, you can even die because you develop shock, you develop anemia, of severe anemia, you become very weak. So if you keep in the house and you don't go to the hospital and you keep there rotting, our youth of our generation, 8 television will not support that. 8 television has come out to say we don't want any more deaths from septic abortion, and therefore we should know that septic abortion is a killer. You should never have an abortion, even if it is any of the types I've talked about, and you come out of the hospital, or it is complete at home and you don't come to see a doctor. It is so bad to yourself because it can cause sepsis. If there is an abortion, you have to take medication. Otherwise, it can cause sepsis and you can easily get septic abortion and you die. So let's look at the signs and symptoms. How do you know that I've got an abortion? First of all, you have to be pregnant. We have seen you are a pregnant person. You know you have tested, you have done HCG, you are pregnant. So you will know that I am pregnant. So the signs and symptoms you expect to know that you are now likely to be getting an abortion. First of all, it is low abdominal pain is one of them. Another one is vaginal bleeding. Another one is you can start even vomiting. You can develop fever. You can develop chills and rigors. Those are the most common signs and symptoms. Or, as we have said, missed abortion, you can not feel the fetal movement of your fetus inside the uterus. So those are the signs. If you get any of those, especially PV bleeding, please, if you are in Mbarara, come to Mars Medical Specialist, opposite Lakeview. We have specialized care about abortion and post-abortal care for those who have gotten any type of abortion we have talked about above. So from there, I would like to have discussed my fellow colleagues and youth, especially watching 80 television. We have discussed about types. We have discussed about signs and symptoms. We are now going to discuss how do you make a diagnosis. How do you know that? First of all, you have to go to the hospital. We have said a scan, ultrasound scan, is a very important issue to ascertain if you have a live fetus still, if it has passed on, that's in missed abortion, or if it has come out. Do we have a complete emptiness of the uterus, or we have some products of conception remaining, which we called above incomplete abortion? And thereafter, you have to go to the hospital. They have to do some other tests of blood. They need to know whether you have, they repeat HCG. They have to do complete blood count to see whether if you have sepsis, if you are developing sepsis, or if you have bred, the HB estimation, hemoglobin estimation, to know whether you have lost a lot of blood. And at Mars, we are very lucky. We have a very nice lab, and we can do all that. And another thing is, if you need blood, we can easily get blood for you. Or if you have lost a lot of blood in any part of this nation and in East Africa, wherever you are following us from, you can get free blood transfusion anywhere, because blood we give it for free, and it is always given to at a free will to anyone who needs it. So we do those tests at Mars Medical Specialists. We do a very nice ultrasound scan, which is important to ascertain which type of abortion you have gotten. We do CBC. We can do other tests, like, for example, in missed abortion, we need to look at the other tests, that blood clotting profile. We need to look at bleeding time. For those ones who have missed abortion, it needs to be fast. You first do a nerve lab investigation. Blood grouping, I cannot leave it there. So you need to visit the hospital and do investigations, and they check you and they treat you. So another thing I would go to after knowing the types of pregnancy or of abortion, we have seen signs and symptoms, and we have also seen how you can know that I have an abortion. Then what follows after you have known that you have a certain type of abortion of any above I have mentioned? We can do very many things. One, it is management. Management involves medical management, surgical management, and here we're going to start with what we do. If we have a threatened abortion, which is common, and it's killing 20 to 50% of people with miscarriage or abortion, or who get complete abortion, or who continue to get abortion, people with threatened abortion. If you have threatened abortion, 20 to 50% can completely continue to lose their fetus, and it's so bad. And that's why we saw that this topic was very important to discuss with the youth and other people who are in reproductive age here on 80 television. And I think the viewers you have gotten a lot of knowledge, and if you need to ask anything, you'll always reach us and we can guide you on any program. So we wanted to see the management of abortion. If you have threatened abortion, we can give you medication to keep that pregnancy. And the most important thing, you don't continue doing a lot of work. We need complete bed rest for more than 2 weeks, and thereafter, if you get medication from plus bed rest, it can keep your pregnancy alive. If you have any incomplete abortion, we can do what we call evacuation. There is dilatation and curettage, where we use instruments, and there is where we also use manual vacuum aspiration and other methods that we have here or at Mars Medical Specialists that are very safe for you. Then after evacuation, for example, if evacuation continues to take place and it's complete, we give you post-abortal care, which involves medication, antibiotics. We give you painkillers. We also give you a family planning method of choice, so that you don't easily conceive. Because when you conceive, before time reaches or before the uterus prepares itself, you can easily get another abortion. It becomes a very big problem. So management, it will involve evacuation if you have incomplete, and it depends on which type of abortion, as I've told you. But the evacuation is one of them. Antibiotics, painkillers. Then we can do more in counseling, especially those who have gotten abortions and they are psychologically tortured. We counsel you, give you enough counseling, and then family planning is very important in post-abortal care. And then if there is a need for blood transfusion, we transfuse you and then encourage you to keep safe for the next pregnancy. So it is important, our viewers, to know that abortion is killing our youth, abortion is killing everyone. Abortion is causing secondary infertility, where people have the first pregnancies, they abort, and because of the procedures they go through, they fail to get another pregnancy. It's becoming very common to get secondary infertility, and people are crying, especially university students. Please, and technical students, avoid abortion, because abortion is taking a lot of you, and it's causing a lot of you to have what? To have secondary infertility. You fail to produce after university, and then you start blaming traditional herbalists, charms, and other things that you have failed to produce because of your auntie. When you aborted many times at university and you destroyed the texture of your uterus, and the uterus can no longer conceive anymore. So at AET Television, we are so lucky that today we have discussed about abortion, its causes, its management, and then how do we avoid abortion. Abortion can be avoided, one, by avoiding unwanted pregnancies. Use family planning. Family planning is very good because you don't get unwanted pregnancies. Though most of the people who are aborting are youth and they have unwanted pregnancies. Avoid unwanted pregnancy. Use family planning of your choice. We shall come here one day to discuss about family planning. It's a very big topic, but it involves use of condoms, use of implants, use of IUDs, and other things. Then we shall also look at another way of avoiding abortion. Avoid you abstain if you are not married, which is important, so that you don't get unwanted pregnancy. Another thing, if you have habitual abortions, as we have seen, recurrent abortions, you come to us, you go to the medical fraternity, you go to medical centers, you go to referrals, and they will advise you on what to do to avoid, and they do enough investigations so that they can remove anything that can cause you recurrent abortions. Then if you have, of course, another, if you get, you first wait to take another pregnancy, to conceive for more than 6 months and above, so that your uterus can prepare itself to receive, and the body prepares and it builds enough energy to again receive another pregnancy. So those are some of the ways how you can prevent abortion. And if you don't follow what we are saying, And you can easily get secondary infertility. You can get your uterus being removed, which we call hysterectomy, and therefore you can lose it. Because if you lose the uterus, you can no longer produce, or if you die or you've gotten a septic shock, you can easily lose your life. So avoid abortion and we avoid death. So if we avoid death, we can have more productive youth, and that's what HT television is all about, having productive youth who are living in a good life, who are not aborting, who are producing. My advice is that if you get pregnancy, you produce. You produce and you take care of the child. Children cannot die. So long as you produce them, the nature and God will take care of them instead of aborting. Aborting is not necessary. I wanted to end by commenting that there are some types of abortion that are allowed by medical, by the Ministry of Health. For example, if somebody has a pregnancy that is taking her life, for example, if you have preeclampsia, and you are going to die of convulsions in eclampsia or hypertension because of pregnancy, and you are almost dying, we can do that abortion. We can abort that pregnancy. We can terminate that pregnancy so that we save the mother. Inevitable abortion. Inevitable. If we check you and the cervix has already opened, especially the internal os has already opened, even if the fetus is inside, it will not survive because the cervix is open and the bacteria or infection will move to the uterus, and it causes other complications like choriamnitis, and it causes missed abortions. So we avoid, we have some types of abortions that can be legally allowed. Those are some of the ones I've talked about. I thank you so much for listening and viewing us at HTV. We love you. We love your life. We pray that we meet again on another program, and you should share our link so that people of this nation and other nations can gain from our words and our advice and our information. Information is power. Thank you so much. I remain Dr. Mpumziwe Kenneth from Mars Medical Specialist. Thank you.